Hello everyone, welcome to Raaonline. I am Dr. Abhinaya. I am a consultant pediatrician. So in the chapter discussion on neurology, the topic of discussion now is on neurocutaneous syndromes. So in our neurology wards, we frequently come across these patients. Yes, so all these cutaneous markers, I know most of us are familiar with, isn't it? So here we are going to talk about some of the frequently seen neurocutaneous syndromes. So in that list, number one will be tuberous sclerosis. So tuberous sclerosis is a multi-system disease, not just involves the CNS but many other systems, many other organs that we will see shortly. So tuberous sclerosis is autosomal dominantly inherited with variable expressivity. So the prevalence of tuberous sclerosis is somewhere between 1 in 6,000 to 1 in 10,000 newborns. So there are two genes which are implicated in tuberous sclerosis. One is TSC1 and tuberous sclerosis, that is TSC2. So both of these are implicated, but TSC2 gene, if it is positive, it means there is a more severe disease. Most of it are inherited in the autosomal dominant fashion, but we also see spontaneous genetic mutations even up to 65% of cases. So what is the function of these two genes, the TSC1 and TSC2? So these two genes, they are supposedly a tumor suppressor gene. So in tuberous sclerosis, what happens? There is disinhibition of RHEB and overactivation of the mTOR pathway. So basically, these tuberin hamartin genes, they are involved in protein synthesis and regulation of cell size. So when this is problematic, then tuberous sclerosis results. So tuberous sclerosis is an extremely heterogeneous state. So on the one end, you see a very mild disease, where on the other end it is severe intractable seizures with full-blown cutaneous conditions. So you have a severe intractable epilepsy one side to a normal intelligence and lack of seizures at the other end, and this interestingly can be present in the same family. So I told you tuberous sclerosis is a multi-system disease. So we know brain, yes. Next we know it is a neurocutaneous disease. So skin, so heart, kidney, lungs and others. So in brain, 90% are associated with epilepsy. We know epileptic spasms, right? So most often associated with that, we have subependymal nodules, subependymal glial astrocytomas, TAND, that is tuberous sclerosis associated neuropsychiatric disorders, intellectual disabilities and autism spectrum disorder. So these are the spectrum, or these are the conditions that are affected in tuberous sclerosis. Coming to the skin, so we know about the ash leaf macules, right? So ash leaf macules, that is focal hyperpigmentation can be there, ash leaf macules can be there, facial angiofibromas, nail fibromas, that is ungual fibromas, fibrous plaques over the face, chagrin patches, all these are skin conditions. I'll show you images, okay, do not worry. Next one is heart. So in heart, infants present with rhabdomyomas, 90%, whereas the percentage comes down. Can you see here? In infants, it is 90%, it is cardiac rhabdomyomas, but in adults, only 20% have rhabdomyomas. Coming to kidneys, angiomyolipoma of the kidney, very common, up to 70%. There can be simple cysts, there can be polycystic kidney disease, and even renal cell carcinoma very rarely. So other findings are oral fibromas and retinal hematomas. Okay. So these are the organs affected. So skin, brain, skin, kidneys, heart, eyes, lungs, bone is which is missed here. Okay.